Hey, what's going on, guys? Dr. Beau here, and welcome to the Ask Dr. Beau show, the place where I answer your health-related questions 5 days a week. Today's email comes from Kristen, and Kristen asks this. Hey, Dr. Beau, I was recently playing tennis with some friends this past weekend, and I went to lunge for a shot, and I felt a popping sensation in the back of my calf muscle. Did I tear my calf muscle? It's very sore, hard to walk, and even has a little bit of black and blue. What do I do about it? Okay, well, let's take a second here and let's talk about calf strains or sprains or tears or whatever else you want to call it. I'm gonna pull up my handy dandy little iPad here. All right. So let's first off talk about muscle injuries. You know, a lot of times we call them a strain or a sprain or a tear, like I said. Now, it's really not true. You don't really sprain a muscle, but you definitely can strain a muscle, and you most definitely can tear a muscle. Now, the most commonly torn muscles are muscles that actually attach to bones, somewhat like tendons would, and those guys tend to tear faster or easier, so to speak, because the body is being loaded in what they call an eccentric pattern. So most of the time when people hurt their muscles, it's usually like for somebody tearing a hamstring or a gastroc, like Christian looks like she may have, is that the person went to slow down or to stop, and that can cause the muscle to contract or the muscle to pull off or the muscle to actually rupture a little bit. So first thing I want to show you is this. Let me see if I can pull this up. All right, so let's talk about this. This is the gastroc muscle in the back here. As you can see, it sits right here, and then right underneath of it are a whole bunch of different little muscles as well, and different innervations having to do with the nerves that go over the top of it. If I can slow those down as well. There they all are as well. So let's talk about if you should strain the medial head or the inside portion of the gastrocnemius. That's the technical term for it. So Kristen, there are three different grades that your doctor will think about when he's trying to diagnose you. So grade 1 is any time that, and most people would call this a muscle pull, that's how they typically would characterize it. It's very stiff, it's very tight, but you can still go about moving and doing your normal daily activities with pretty much no pain. Most people would say, yeah, it just feels like a little bit of stiff after, or I may have just kind of overdone it a little bit when I was out playing tennis. Now, that is usually characterized by less than 5% of that muscle or those muscle fibers being injured. Typically, with some series of foam rolling, some good stretches, and maybe some even deep tissue massage, that will help to decrease the pain and sensitivity, increase your range of motion, and you'll feel great from there. Now, as you're moving into grade 2, now what you're kind of describing is what it sounds like it's in between grade 2 and grade 3. A grade 2 muscle tear is usually anywhere between, less than 5% is grade 1, so it'd be 6% up to about 50%. That's typically what they call a grade 2 muscle tear. Now, as a doctor, what I do is if you would come into my practice, I would actually palpate over the muscle. I would actually run my finger over the back of the whole entire muscle belly, and what I'm looking for is kind of like a dip or a deviation in the actual muscle. A lot of times if the muscle is like cut, right, it's not cut all the way through. If the whole muscle is this big and it's only cut a little bit through here, you'll actually notice it dip down a little bit. And that is just like a normal muscle tear, just like if you would cut yourself. Now, the bruising that you're speaking about, that's also as the muscle would be bleeding. So the muscle's bleeding and it's trying to lay down more nutrients to almost form a scar underneath your skin, hence while the bruising is there. Now, matter of fact, if you just had this injury, that bruising could get much worse over the next couple of days. Also, something to think about is if you feel with your hand over the actual area, over the actual calf or gastroc, it is probably very warm, if not hot, and that also is an indication of underlying inflammation that is going on underneath the skin. Now, these injuries can take anywhere between 6 to 8 weeks to heal. Why? Because it is an actual pretty significant muscle tear. You know, we start when people come in and have these types of things, the first thing we do is we can even see, can you even stand and walk, or is it too painful? If it's too painful, then we will usually opt for an MRI and work with a physical therapist, because we need to see how deep that muscle tear is. If it's over 50 to 70%, that is a grade 3 tear, and depending on the location of where it's at, sometimes surgical intervention is even needed. Now, saying that it's probably not a grade 3 if you're still out there playing tennis and moving around a little bit, let me give you a few tips and tricks that you can use. The first thing that you want to do is decrease inflammation. So taking an over-the-counter, anti-inflammatory would be really good for you. Also, making sure that your diet is very, very high in alkaline foods that are help to decrease inflammation. You're definitely going to want to use ice over the area multiple times a day, ranging between 10 and 15 minutes at a time. You want to keep it elevated. You want to watch and make sure that it doesn't swell and get too nasty as well. In my office, typically one thing that we'll do is we'll introduce Kinesiotape over the actual area that was injured, and we do it in a pattern that almost looks like a mesh with your fingers. If you've ever seen somebody with Kinesiotape, it lays down and it looks kind of like this, and the idea is it pulls the skin up, which helps to increase circulation, which helps to get the right nutrients there and get rid of all the nasty inflammation. After a period of about 1 to 2 weeks of that, we generally start to really do some very easy rehab, physical therapy types of things, having to do with very light massage, very controlled stretching, and we start to do some more active range of motion things depending on the muscle that is injured. Again, guys, this is just stuff that I'm talking about from a general perspective, not necessarily talking 100% about a medial gastroc strain. Kristen obviously is in front of me, so I can't give her complete medical advice, but this is just generally stuff that we see from the everyday, weekend athlete that's out there. After a period of time, they'll start building strength back up. Then we want to get a little bit more aggressive. We'll introduce foam rolling, we'll introduce some stretches, and then finally we'll start getting back to some full movement. A lot of things that people ask me is, Beau, do I need to be on crutches for this entire period? And really that's up to between you and your doctor, but typically if you're weight bearing and you can move through a range of motion and it's not incredibly painful, I typically say it's best to not use crutches, because I want to try to lay down the correct muscle fibers that are oriented in the right pattern. Also consider wrapping the area and keeping it, in a sleeve with Kinesiotape, just to decrease inflammation as well. Last thing I want to tell you about this is, if you are a grade 3 rupture, guys, this one can take quite a long time. This one can take a few months to rehab back and not only get the muscle fibers lying in the right direction, but you have to work and do a lot of stretches and exercises to rebuild the strength surrounding that. That's why athletes are very, very concerned about, being in season and, tearing or pulling their hamstring or their gastroc or their shoulder or even their pec muscles with certain things that they do. So, Kristen, I hope this helps to answer a little bit of a question for you today, having to do with your tennis injury with it sounds like your gastroc. As always, guys, if you have questions, please ask them below, as I always will try to jump on here and answer them for you guys. Talk to you later.